Thanks for joining us. We are on day 2 of the Remote Design Jam. We have 7 teams presenting today. Just to give you a little bit of an idea of what we're going to be doing, there is a 5-minute presentation followed by 3 minutes of Q&A. So once it is Q&A time, feel free to either click the raise your hand button or enter something in the chat, and then we'll get to all the questions with the time permitted. Like mentioned, we have 7 teams, starting with team 9 all the way through 15. And we saw some great presentations yesterday, and we're really excited to see the presentations for today as well. Just a quick note, we are recording this. Yesterday's presentations are already online. If you'd like to review that and other details, please go to sfuxd.com/jam. That's where we're going to be putting these recordings. Quick rundown through the teams. Team 9 is with Christine, Team 10 with Chris, 11 with Pankti, 12 with Shannon, 13 with Jesse, 14 with Jared, and 15 with Munmita. And so without further ado, let's welcome Team 9 with Christine.
Can you see it now?
Yep, I can see it, and I will go ahead and start the timer.
Okay, great. Hi, everyone. Thanks for being here. I'm Christine, and I'm going to present for Team 9. So today, I'm going to go through our design process, our research and insights, walk through how we define the problem, our solution, and then answer any questions you might have. So for our design process, we tried to implement IDEO's design thinking approach as much as possible with the time that we had. That being said, we started off by discussing different problems that were arising from COVID-19, and some themes that kept coming up were hoarding of PPE and toilet paper. And so we did some more thinking and decided to focus on how to stop the spread of misinformation to prevent panic and hoarding of PPE needed by healthcare workers. So we did some more research on how misinformation spreads, and not surprisingly found that misinformation about COVID-19 spreads rapidly online through social media like Twitter and Facebook. We also learned that users find and share information about COVID-19 on these platforms because it's quick and easy. Oftentimes, misinformation about COVID-19 will play to people's existing biases. And so when that happens, people are more likely to react to it by sharing that content again with their own followers. And then as a result, Twitter and Facebook will make sure that the content is shared with even more followers. So it turns into this unhealthy cycle of spreading misinformation. And one way to stop or limit the spread of misinformation is by encouraging users to just simply stop and evaluate the information before they share it. And so that was important because it draws a distinction between people who are intentionally creating misinformation with the intent to deceive others versus people who they don't intend to deceive anyone, but they're just spreading it by virtue of not checking information before sharing it. So we created a persona named Hadley to capture this idea of the uninformed spreader. And Hadley is socially active. She's on Facebook a lot, and she cares about her community. And she's been reading a lot of scary things online about COVID-19, and she doesn't know what to believe. So she needs a way to find legitimate information about COVID-19 online so that she can learn how to protect herself and others. And so for our solution, we approached the problem from 2 angles. One is to focus on giving information about COVID-19 from trusted sources, and then also encouraging people to just stop and think before they reshare information. So our solution is to add new features to Facebook. We redesigned its COVID-19 Information Center and also added a fact checker to it. So this is what Facebook's existing homepage looks like. You can see in the bottom left, there's a link to its COVID-19 Information Center. If you click on that, it then brings you to the Information Center where there's news updates and statistics on COVID cases. So for our solution, we redesigned the homepage so that the COVID-19 Information Center is the first thing that users see when they log in. They don't have to click on a link. There's resources from the CDC and World Health Organization, which are known public health organizations. There's also case statistics that are easy to read, and they're right at the top as well. On the right side, there's news categories that will lead to articles that are written by different health experts on topics related to COVID-19. And then at the top right is the fact checker, and users can put a link into it and it'll go through the content of the article and look at the source. And if it's something that if it's from a not known or an unknown source, it might pop up with a little warning, and then there's a link where users can click on and see other articles written by health experts on that same topic. So that was our way of just trying to get people to think and assess the information before they share it. So that's our solution, and thank you everyone for listening, and I wanted to open it up to questions.
Okay, great. And I will reset the timer there. And let's take a look at any questions that might have come in.
We did not have any questions come in yet that I think people might be typing. Oh, the first question just came in. The first question is, how did you conduct your research?
We did a lot of domain research, and then one of our teammates went above and beyond and did a lot of user interviews as well. So we got insights from those.
Cool.
I have a question about showing the kind of the COVID-19 page right out like right as you log in. Do you think that users would be able to dismiss this if they didn't want to see that, or if they've seen it before?
That's a good question. I think that's something that we would definitely want to explore further down the road, because you're right. The way that their COVID-19 center is right now, it's kind of optional. Like they have to look for it and then choose to go there. So yeah, very good point.
Okay, and there's another question from Christopher. He's asking, could you tell us more about the fact checker? How are facts checked?
Another good question. So for the fact checker, we wanted to kind of focus more on, like, the point of it was to just get people to think about whether or not, just to evaluate the information before automatically resharing it with people. And so it would look at the source of the information. So if it's from a known public health agency or a news station, it might flag it if it's just like an individual writing that content without any references to who it's citing. And then it would also look at the content of the information being posted, and just prompting people to think about that and see what other experts are saying before sharing it.
Great. And another question just came in too, and it's what type of questions did you ask users?
You know, I don't have the specifics on that, but we wanted to know about how they're finding and learning about COVID-19 online, what social media platforms they're using, if they're sharing that information with anyone else, and then how so.
Great. And then, Alex, do we have time for one more question?
We do. We have time for one more question.
Okay. And Anita is asking, for the fact checker, does it indicate the level of authenticity?
No. we didn't go into to any levels, and we tried to actually stay away kind of from saying whether or not information is true or false, because right now, you know, even the experts and the researchers are learning new things about COVID-19 every day, and there's conflicting views even among those experts. So um, again, we just wanted to kind of prompt people to evaluate the information, make sure that it's from a source they know or have heard of maybe before they share it, but without saying whether it's true or false.
Cool. Thank you.
Great, thank you very much.
Thank
So
you.
the next team is team 10 with Chris. So Chris, go ahead and share your screen whenever you can.
Okay, I just need to wait for the other participant to stop. Perfect. Let's see. Can you see my screen?
Yep, coming in clear. I'll
Great.
start the timer.
Okay, cool. So hi, everybody. This is our team. And I just wanted to start off by saying how lucky I feel to have been able to work with this team. Everybody was very dedicated and hardworking. And during the process, we were able to come up with this concept of Fam Jam. And that's what I want to tell you about tonight. So when I say that this is an intelligently curated empathy framework, that may not mean anything to you now, but I'm hoping over the course of the next 5 minutes that will start to make more sense. When we looked at the problems that were facing people amid this pandemic, we looked at a lot of different user groups, ended up honing in on this kind of core group of people, which is working families who are sheltered at home with small children. And how for people that are unaccustomed to this, or even for people that are, there are significant mental health challenges that are coming with this situation. Parents are stretched really thin, and this is happening to people from all walks of life and for all different reasons. During our research, we found that a lot of people were having a really hard time keeping perspective and finding routine. So, well, while we were researching, one thing that we discovered was there's a huge opportunity here to sort of take a potential bad thing and turn it into a positive thing. Life-threatening events can often push people closer together. Granted, this stressful situation, we're afraid we could push people apart. So when we started to think about how might we asked, how might we empower families to use this time to strengthen rather than to strain their relationships? And this is kind of what led us to this idea of Fam Jam. It's this curated framework of empathy routines to build into your life. Now, we wanted to make sure that this was something that would be accessible quickly and would have lasting power. So we conceived this in both an analog and a digital way. In its simplest form, FamJam is a collection of empathy prompts, cards that you can use and basically play with your family throughout the day to share things together and to bring each other closer, even if it's just for short periods of time. If you get set up with this right away, we would offer you our deck of prompt cards and a simple paper scheduler that you could fill out at home. And we believe we could bring this into people's homes in 2 weeks to 30 days. Down the road, we'd like to produce this as a digital offering as well, where we could gather some simple data about your family and basically serve you up the prompts that we believe are best suited to your situation throughout your daily routine. There's basically 3 steps to this concept. There's a concept of building your routine, arranging these prompt cards and playing them, and then regrouping with your family often to reflect on how this is working. Some samples of what we're talking about when we talk about these prompt categories are empathy games, exercises, meditations, and group reflections. These are all meant to be done within a period of about 5 to 15 minutes throughout the day and in different ways for all the members of your family. One perfect example of this group reflection would be the concept of rosebud thorn. I think design thinkers might be familiar with this idea, but basically, I think that you could replace the asking how was your day part of the dinner conversation potentially with a quick game of rosebud thorn, where people share something that happened to them that they liked, They share a new idea or something they're looking forward to, and they share something that they could use some help with. Now, we expect that this could be something that would become a sort of lifestyle activity that people build into their lives. We believe that practicing mindfulness and empathy is very much like learning a new language. We think that this concept of FamJam and further development of it will provide the tools necessary to learn this language together as a family. And we'd really like to see this turn into a community effort where people could potentially share new prompts, share their experiences with this framework, and build it into something more than what we have just sort of developed it into over the course of the last 4 weeks. That's FamJam. I'm open to any questions you may have, and I really appreciate the opportunity to talk to you about this tonight. Thank you.
Awesome. Thank you so much. So let's give it a minute to see if any of the questions come in. And I did really like that rosebud thorn example. I must say, I kind of do something at home similar at the end of every night. We kind of ask a similar question, more of the rose question, but not the other thing. So maybe we should start integrating that.
Okay, it looks like some questions are coming in. The first question from Stephanie is, how do you plan to attract and engage new users?
That is a very good question. I think that primarily what we're anticipating right now is trying to spread this through our local networks and through social media. Essentially, once this deck is produced and in hand, we'd probably just try to push it out to as many of our local networks as we could to continue to sort of beta test the idea and then further refine it from there. Beyond that, I mean, we'd really like to use that phase as a proof of concept before thinking about how we might introduce it to a larger market.
Cool. And the second question is, how did you conduct your user research?
Yeah, we had a lot of different ways to conduct user research, and we kind of assembled them through a design thinking process to begin with. The first thing we did was just started sort of naming a lot of different user groups that might be affected by this pandemic. And then each member of the team spent time digging deeper through some user interviews, some online research, looking through what people were talking about on Reddit Family. And from there, just as a group, you know, we talked about which areas of sort of user groups we thought were most exciting and would have like the most sort of Goldilocks potential for this project. And we decided that, you know, the families at home with children would be, you know, particularly meaty and accessible subject matter.
Great. And then Christine is saying, great presentation. I love this idea. And she's asking, are there any direct or indirect competitors that you drew inspiration from?
So this is a really good question too. And I saw a couple people mention in the chat, well, this sounds like something that we do once a day at night, and maybe something we do, you know, or we used to do with my family. So reading a lot of that stuff where people like had these bits and pieces of ways that they would practice, that just kind of led us to putting it all together. And then there's a card game called Flux, which is it's not a competitor, but it's sort of a similar idea in that the game dictates the rules of the game as you play it. So the combination of those two things and just wanting to build an accessible resource is really what led to sort of framing it out in this way, I think.
Cool. Thank you. I think this was it for the questions, but really great idea. I love it.
Thank you so much.
Great, thank you so much. And so the next presenter is Team 10 with Pankti. So go ahead and share your screen, and whenever you're ready, we will start the timer. Pankti, it seems like you're not muted, but we can't hear you.
Yeah, can you hear me now?
Oh, we can hear you now. Great.
Awesome. Just give me a second. Can you guys see my screen?
Yep, looking good.
Awesome.
I will start the timer.
Okay, cool. So yeah, we started off this design jam session with exploring what all possible areas that we would want to look at, and we came across some pretty interesting problems along the way. So one of them was, how do we help scientists come develop vaccines? And the other was the issue of racism that people are faced, and what could be done. So these were some of the areas that we looked at, but due to lack of information, we just thought of dropping those ideas, and we went ahead and looked at how do we help people stay connected with friends and do stuff together digitally while they stayed home. And so we just thought of what all possible areas are there with respect to that. And we thought of focusing on the age group of somewhere around like 45, 50 to 65-year-olds. And yeah, so these are some of the considerations that we had, that what are there, so which I will be covering in the presentation. And so yeah, so basically the target, so we just did a little of the analysis of this age group, and we realized that they have a lot of responsibilities in terms of work and family. And we wanted to understand how their life is before the time of coronavirus, before. And we also saw that if they do use social media, well, they just happen to be the second the second least users of social media, and they use Facebook the most. And yes, they do perform like a lot of tasks on using technology, though they are not the early adopters. And so we just, these were their different needs that we figured out, and how they've changed in times of coronavirus. And so everything's become pretty digital right now, and we were thinking of, so what can we do to help them socially engage and without, like without them going digital. And so so this is, we did a how might we analysis, and out of that we realized that we wanted to focus mainly on a platform which wasn't digital. And hence we came to the idea of the book station. So what book station it's actually a book club kind of a thing, where people where we had these a couple of personas, and who all of these people, and they would want to who read books, but then they also want to discuss about the books with other people. And so I will just get can you guys still see my screen? Just wanted to check.
Yep, we still see it. It's
Awesome.
not full screen, but we do see it.
Okay, yeah. So I'll just run you guys through the user flow. And yeah, so once the user comes on the landing page, on the website, sorry, he can he can log in and sign up. Upon signing up, he lands on the home screen, where there are particular there are like some major workflows around challenges and book clubs. So I'll just get into those details.
And we have about 1 minute on the timer.
Okay. Okay. So I'll just make it quick. So the book club was basically I could create, I could access what was created by me. I could join a book club and browse book clubs. So basically, um, so yeah. Okay, I will just jump to the prototypes since we are. So these are some of the prototypes that we've made.
So it looks like now we're still on the site map, or at least my screen is.
Okay. Is it the same for all?
I think so. You might need to stop
Yes.
sharing and then share instead of just a window, either share the window with the prototype or another window. And since we're coming up on time, let's, if you can bring the prototype, that's great. Otherwise, if it's okay, we can just jump straight to questions. So let's give it just another minute to see if you can show that prototype.
Okay, okay. Can you see this screen right now?
Yep.
Okay. It's just that it's not exactly clear. I may not be able to zoom into the details with these wireframes, unfortunately. So basically, yeah, like, we've just, due to lack of time, we've just created the paper sketches for the product. And so we've just tried to create all the screens and show the interaction of the product here. Yeah, I think I'd like to go to the questions now. I may not be able to zoom in here.
Okay, great. We can switch over to questions. So as the questions come in, if you do want to try to bring up another screen or the prototype, we could do that. But otherwise, let's open the floor to questions.
Great, and it looks like there are already some questions coming in. Shannon is asking, what portion of this book club experience would be offline?
So for the book club, the user could read the books offline if they have it on hand, but they could definitely read the books online as well.
Great. And Christopher is asking, how did you work on your personas?
So we did a lot of research on the personas. I've not covered that in the presentation, but that was unfortunate. That wasn't done by me. So I think another team member covered it, and she would be in a better state to answer the question.
Great. So if another team member does want to answer the question, if you go ahead and press raise hand, then Anita can unmute you, but otherwise we can continue ahead. One question I had was regarding the sitemap. The sitemap was really nicely designed. What was that designed in?
Rodrigo, do you want to answer that? That was also done by another team member. Actually, yeah, the exploration and the brainstorming was on Koggle, but I think the sitemap was, I'm not sure
So
about this.
Oh, I think, yeah. Yeah, we can hear you now, Rodrigo.
The site map and the user flow, I think you were not able to see the user flow because she was showing the PDF in a different screen, I think. So we will not able to see it. But all that was designed in Sketch.
Okay, great. So it looks like we have one more comment, but not a question. And then we can move on to the next team. So Pankti, thank you for sharing. And the comment was, I guess somebody imagined that there would be little book club stations around the world with disinfected books and UV lights. And so definitely an interesting, interesting note. Well, thank you very much. So that was team 11. And now we're moving on to team 12 with Shannon. So Shannon, go ahead and share your screen and we'll let you know when the timer starts.
Hi. Okay, let's see. Here we go. Does that work?
Yep, looking good. I'll go ahead and start the timer.
Thanks. So this is my first time using Miro for a presentation and also actually just really using it at all. So our team ended up focusing on designing things that are friendly for populations around 65 years of age. Obviously, every individual person is different. So yeah, we're team 12. We had myself, Shannon, and Tasneem, Priya, Anna, Jenny, and Aaron. It was super fun to work together. So I'm just glad we got to experience this. So first of all, we brainstormed just all the problems we could think of. And one of them that we kept kind of circling back to was how right here it says designing for seniors. In our research, we actually learned some other terms for, instead of senior citizens, some preferred terms are just people over 65. One person actually said chronologically superior persons. That's kind of a fun one. But yeah, so we were talking about all the challenges that this population has during this time. So they are you know, more vulnerable to the coronavirus and also struggling to use virtual tools that could help them stay safe during the coronavirus. So focusing on that group, and apologies for any background noise. We actually watched a video by the Nielsen Norman group. I don't know if anyone knows them, but Jacob Nielsen is still alive. I thought they seemed so official. I was like, oh, this has probably been around for like so long. Maybe he was alive like 100 years ago, but he's in Norway. He's just a guy. He's there. And he made a video about how to help with the coronavirus. And one of the things he said was a lot of digital tools aren't very well designed for people over 65. And the Nielsen Norman group has already done a lot of research. So we took advantage of the research they did. So we built some empathy maps. I don't know if you all have used these before, but we read the research by the Nielsen Norman group to try to understand when folks over 65 are using digital tools, what are they hearing? This is really small. What do they hear? What do they think and feel? What are they seeing? What are they doing? We also tried to empathize with designers seeking to design for people over 65. So like, why is there this disconnect? Like what if there's a population that has needs that can be served with digital tools, how come those digital tools just aren't designed well for them? This is one that we did a little bit more research ourselves on. Some of the team members reached out to their fellow designers to just ask them like, hey, you know, do you design things that are accessible to people over 65? If so, how do you do it? I don't think we have time to go too much into the details, but so yeah, we've decided to focus on the designer. Like, how can we help ourselves as designers and other designers make products that are accessible to people over 65? So we thought of kind of what phases a designer goes through when they're trying to design a product that's friendly to people over 65. So they like discover like, oh, this is a thing. I can design for people over 65. They try out the ideas. They probably advocate for the ideas and then help their organization adopt them. We thought about, yeah, the things that might help people go through that journey, some of the challenges of going through that journey. And let's see. Yeah, so we collected some research. We also decided to look at a few websites and just like to ground ourselves, like how are the AARP website, Walmart.com, like how do they hold up to these standards that we're reading about? We have quite a few details here. One of the most interesting things was Walmart.com did pretty well with all of the quantitative measurements, like their buttons were big enough, their font, like contrast was good. They didn't do so well with the more qualitative things. Like everything that was important was always below the fold, which that was a new thing to me that I didn't know before, which was that's good practice for everybody to put important things above the fold, but especially for seniors, scrolling is not necessarily an intuitive thing, and it might be mechanically difficult if your hands have arthritis or something.
We have
okay, I think I'm out of time, right?
Yeah, well, we have 1 minute left.
Oh, okay. Okay, so I'm gonna actually skip to, we wrote down some interview notes. So kind of some potential solutions. These are still tentative. We thought of a website that kind of gathers resources, because all the research we found was really scattered. There was no like one easy place to like be like, how do you design for seniors? I mean, people over 65. And we thought of other educational experiences for designers. I think one of the difficult things is the bigger question underlying this is why is any site poorly designed and from any point of view? Like there are all sorts of organizational problems that can happen. So the key would be for us to figure out what solution do we actually have leverage with. Like, so anyway, what we're hoping to do going forward is at least come up with a list of some resources that we can point all of our designer friends to. I think that's like a first step. And we do have that here at the end. So we will share this. Yeah, thank you so much. So thanks to the team also. Our team was awesome. And also it's been fun to hear the other presentations.
Awesome, thank you so much. We will go ahead and jump into Q&A. So if you have any questions, feel free to type them in the chat. I think one might say that Nielsen, I think the term you used was chronologically superior. So
yeah,
a lot of research that comes out of NNG is great. So really cool that you guys leveraged that.
Yeah, they still do quite a bit of research, and it's really awesome to see what they've learned. They do a lot of usability testing still.
Great. Anita, have any questions come in?
Not yet. But if anybody has any questions, please use the Q&A, or if you want to raise your hand, you can also raise your hand and we can unmute you if you want to ask your question directly. Either way works. Yeah, this is Jacob Nielsen, by the way. And I guess he's somewhere in Norway. And this is a really fun video. It's only 4 minutes long, and all he's talking about is what he thinks designers can do to help with COVID-19. So that was pretty fun. Really interesting. That's cool. Yeah. Okay, it looks like Christopher has a question. He's asking, did you work directly with over 65 people? For this, we kind of did before we started doing this project. So a lot of us, that's why we cared about it so much. We were all talking about our acquaintances and family members and friends who are over 65, and we were talking about like all the different conversations we've had with them and struggles they've had with video chat and online ordering and stuff. As far as doing like specific usability testing or anything, not yet. We read all of the Nielsen-Norman research. And yeah, I am interested though. My grandparents have successfully ordered things from Walmart.com for pickup. And after trying to do it myself, I'm like, how did they do this? I could barely figure it out myself. So I'm gonna have to ask them how they did it.
Great, thank you so much.
Yeah.
I think somebody is requesting that if you could post that Nielsen Norman group in the chat, that would be greatly appreciated.
Sure, yeah.
Otherwise, that's it for time
Okay.
for Team 12. So thank you very much. And so we have Team 13 next with Jesse Sun. And this team might have originally been Team 6, but in any case, Jesse Sun, whenever you're ready, go ahead and share your screen and we will prepare the timer. And Jesse, it looks like you're not muted, but I don't hear any audio coming through. So let us know if your mic is working as well. So it looks like maybe Jesse's audio is not coming in. So unless, okay, yeah. So what we'll do, Jesse is Team 13. And it looks like she's resetting Zoom. So what we'll do is we'll actually move on to Team 14 now with Jared. So Jared, go ahead and share your screen, and then we'll get to Team 13 and Jesse afterwards. Awesome. And so Jared, I think we see your screen, and let us know if your mic is working.
All right, can you guys hear me?
Yep, loud and clear. I will go ahead and start the timer.
Cool. So the application that we decided to create is called IC Therapy. And basically, this is a mobile application that allows for the post-ICU integration process back into the real world. So the problem that we decided to tackle is that many survivors of severe COVID-19 cases are likely to suffer from post-intensive care syndrome. So this involves a loss in cognitive function in about 75% of survivors and mental health issues in the forms of depression, anxiety, and PTSD later down the line. So the issue is that occupational therapists and mental health professionals are going to be overwhelmed by this increase in patients as a result of the pandemic. So the solution that we came up with is a mobile application that basically conducts daily checks on those ICU survivors in order just to check on their cognitive, mental, and physical wellness. The app curates different mental exercises and provides some content that will aid in their recovery. This solution isn't really meant to replace those in-person sessions, but it's really meant to supplement that progress in between in terms of the recovery process. So this alleviates some of the workload of those caretakers that are involved in assessing their loved ones. So we had to do some research, and we found some alarming results among hospitalized patients. Almost 3/4 of those were either 50 years old or older, and almost 90% of them had some kind of underlying medical condition, such as hypertension, chronic lung disease, or diabetes. So in order to guide our project, we created a persona or a user story. And our user story is, it's Michael. He's a senior citizen from New York, and he has a below average technical competency. And he was in the ICU as a result of COVID-19. And because of that, he's going to suffer some complications later down the line. And this is going to require in-person sessions. So we were hoping that this app can kind of alleviate that process. Here's some screenshots of this application. This is the authorization screen. I'm going to go more into detail on this when I show the prototype. Here's the getting started dialog that users will see their first time coming in. This is the main navigation of the application. This is a flow of the complete activity, and we're going to go ahead and jump over to the prototype. So basically the user's first time coming into the app, they're going to see this splash screen. We're going to go ahead and sign up, enter in some credentials. Whoops. So this is the authorization code, and this is provided by the physician. And sorry, this is glitching out a little bit. Let me just refresh it really quick.
Hey, just really quick, we're getting a couple comments that people cannot see the screen.
Okay.
I'm seeing it, and I think some other people see it. But if you are having trouble seeing the screen, just mention that in the chat, and we'll just like refresh just to make sure everything is going well.
Okay.
So let's just give it a quick minute.
Should I wait to continue?
Yeah, I don't see any additional. Oh, it looks like some people are saying can't see the screen either. We'll wait for recording. Can you do me a favor and go ahead and just stop sharing and then resharing your screen? That might help.
Okay.
And I've paused the timer.
Okay. Can you guys see it now?
I can see it, and it looks like some people mentioned, oh, yes, they can see it. But it looks like some people mentioned they had trouble, but now it's working. So looks like we're good to go. Thank you for doing that. I'll go ahead and start the timer again. There's 2 minutes, 30 seconds on the clock. So go ahead.
Okay. So when the user's joining, they are provided an authorization code by their physician, and they're going to go ahead and input this code. I don't know why it's glitching out like that. Basically, when they enter the code in, they get thrown into their physician's patient pool so the physician can have a scalable management platform to basically manage all of their patients. This is the getting started dialog, and this is just going to explain what the application does. So you can take daily evaluations. Those results get sent to your doctor, and then based on those results, your doctor can give you future recommendations and also update you on your progress. So normally you would start with an activity, but we're going to just skip over to the home menu. This is more of a dashboard view. We kind of want to keep it on a simplistic sense because we know that our average user base is more on the senior side. We're going to jump over to the activities panel. Here you can just see some activities that you can do, some cognitive exercises as well as physical exercises. We're going to get started with a stretching wellness exercise. And here the user can either just get started or view the time length, description, or even change exercises based on what they want to do. Once the exercise is over, the user can provide some information to their doctor, such as some difficulty information, or they can write some notes or provide an audio segment that can later be reviewed by the physician so that the physician can have more of a frame of reference and they can have a better idea of what to recommend to their patients. So now that activity is over, we're just going to jump over to the profile section. This is looking a little cut out. Normally you would see some tiles here that would basically allow the user to navigate to some different features, such as some data analytics on their progress that they're making. They can view some test results, customize some various profile features, set up some notifications and favorites. And this is really cutting out. But we're back at the home screen, and I'm just gonna go ahead and say thank you very much, everybody. I'm gonna open up the floor to any questions that anybody has.
Awesome, thank you very much. And for those of you that might have lost some of the visuals, we are recording this webinar, so we'll be uploading the video again later tonight. And yesterday's video is also online, so both day presentations will be online. So let's go ahead and open up the floor to questions.
Great, and I can see a couple of questions already. Shannon is asking, how did you get the data about ICU and how it affects people?
That was found from a New York Times report. We don't have the actual scholarly article that was written for that. We were just kind of going off of what we were finding in media.
Great, and another question is, how will you drive continuous engagement?
Yeah, so we're kind of hoping that the communication that we're creating between the physician and the patient, giving that, clear pipeline allows the user to have more of a closer, intimate relationship with their physician. And with the physician's management platform that we would like to have on the other end of this, there could be a lot more visual analysis of how they're doing. And I feel like that would be really rewarding and pleasing for the patients to kind of see their actual progress on screen.
Great, and it looks like there's one more question. Is the idea that the activities will be customized based on the patient? And also, is it the patient's past medical history? Is the patient's past medical history taken into account while recommending these activities?
Yeah, so I'll answer the second part of that first and then jump back to that first part. Basically, the physician would, through the management platform, would be able to have a better understanding of their patient, and I guess the physician can choose whether or not they want to use past medical history to recommend certain exercises. And also, if we're going to release an application like this, we kind of want to have a really steady dialogue with the medical industry. So we would want to kind of tailor more of these exercises towards specific patients and allow some customizability there.
Great, and then there's one last question. Marina is asking if you have thought about privacy issues.
Oh yeah, we've definitely thought about a lot of that whole, you're not allowed to reveal any information. We were hoping that some of these data analytics that we could provide to physicians and patients, we could scrape off any of that personally identifying information. And we definitely want to make sure that we're not, overstepping any boundaries in terms of, patient privacy.
Great, thank you.
Thank you very much, guys.
Thank you. Great. So we'll be going over to team 15 with Munmira next. So whenever you're ready, please go ahead and share your screen, and I will start the timer. And then afterwards, we'll go back to Jesse's son. I see Jesse has logged back into the system. So Munmira, whenever you're ready, we can start the timer. And we do see your screen, or at least I do.
Can you guys hear me?
Yep, I can hear you.
Okay, and see my screen?
Yep, and now we're in full screen. Looking great. I will start the timer.
Okay, thank you. So, hi everybody, I'm Munmita and presenting our product, Care in Crisis. Here is the fabulous 4 of our team. I cannot actually, okay. Here is the fabulous 4 of our team 15. The COVID-19 pandemic crisis has impacted everyone's life, including myself. My dad is 69 years old and have a lot of pre-existing medical conditions. He lives alone in another country. It's hard for him to be quarantined all the time, and it's frustrating for me that I cannot help. So our team worked hard for the past 4 weeks to find a viable solution for this critical challenge. The challenge is people who live alone need assistance to complete essential tasks during quarantine are unfortunately very helpless. With this challenge, we expanded our definition of those who are in need. So we considered not only the people who are at high risk, but also the COVID affected people who need non-medical help in a secured contactless manner. Here you can see that as of now, currently in USA, 43% of people live alone, and a third of which are 65 plus. So it's a widespread problem. So our mission for Care in Crisis is to connect local volunteers with those who need help completing tasks. So we decided to design a web and mobile application to connect those people. Before diving into the design, we did a lot of qualitative and quantitative research, including SWOT analysis, to our competitors, direct and indirect competitors, and found some opportunity areas, threats, and some UI inspirations. To understand the insights from an individual perspective, we conducted user interviews with 8 individuals aged like over 65 and discovered that older people are more comfortable using in computer and iPad over smartphones. So this is why we chose to create a web application and not only mobile application. And we did a detailed survey and we got 30 responses out of that. And you can see that we got some insights from that. And after synthesizing all the research data, we come up with 2 personas, users personas. One is Crystal, she is elderly, and the other one is Jami, who is an immunocompromised girl. They have their own different pain points, but both of them are most vulnerable to the virus and need help to stay at home. So after grouping up all our user insights into an affinity diagram, we prioritize the key features of our product. So mandatory COVID-19 screening was important because the safety of our users was very our priority. And then monetary reimbursement verification and task completion verification for the requester and the volunteers was also important. And language preference feature we added to make it more globalized. So here is our elaborate user flow showing all the task flows from onboarding to reimbursement bill. And we have also designed a mobile flow for the volunteer side so they can use it while they are running errands. So after we considered the user flow, we turned into our wireframes in different level of fidelity, and we spent quite a lot of time to create a style guide and branding because it was important for us to address the accessibility issues because there will be a lot of elderly users. So we did a lot of research for color, typography, and font size, etc. And you can see here our landing page here. We added nice illustrations, content, and large calls to actions to make it more inviting and informative. We separated in our sign-up process. We separated the lengthy sign-up form and then a questionnaire and COVID-19 screening form in multiple pages to make it less tiring for the users. And this is the volunteer request iterations. Here we sectioned off, improved our visual distinction for volunteers that matches a request perfectly with the volunteers. And task detailed iterations, we removed the tracking functionality because it would erase the privacy concerns. So we removed that in our final iteration.
We have 1 minute on the timer.
Okay, so safety messaging, we actually got rid of the COVID message blanket statement because it was doing nothing. So instead we put a safety tips card so that it can be more specific and easy to remember. And then the final, it was addressing for the safety as I was talking about, that verification of the payment and ensuring the quality of service. And then in future, we want to design more screen for the mobile and user testing, usability testing, more of that. And also we want to adapt the product so that we can use it, people can use it after the pandemic as well. And that being said, this is our care in crisis, and we believe that where is the help, there is a hope. So we want more people to sign up for the volunteering and help to save lives in this tough situation. And I'm gonna open up the floor to questions right now. And thank you.
Great, thank you very much. So we'll give it a minute to see if any questions are coming in. I do like it was a very comprehensive user flows and mapping that you had there. So that was really nice. Thank you. And for the actually time crunch, we couldn't show you our prototyping. Otherwise, we have our Figma link. You can, in our presentation, you can just see it. Great. Anita, are there any questions coming through?
Yes, it looks like the first question just came through. Stephanie's saying, crazy seeing those stats on people who live alone in the US. Good job on research, very interesting. How would you get the word out to volunteers, and how might you ensure that the volunteers take the right precautions in order to not put the people they are helping at risk?
Yeah, that was the main concern of ours. That's why we put a really mandatory COVID screening, that our volunteers doesn't have COVID infection. And we all the time in our volunteer side, I couldn't show the volunteer side screens because of the time crunch, but there is always on the dashboard or mobile version of the application, there will be always a safety tip cards, so that they are always getting reminder that you should do these things. You should wear gloves, you should wear mask, and you should wash your hands. And before, and this service we want totally in a like contactless form. So we don't want to transact with our users directly, but before leaving any items outside, or before giving any service like dog walking or anything like that, we will make sure that our volunteers definitely use the safety tips and be safe by themselves and for the others.
Great. And then Christina's asking if you expect there to be more people asking for help than people offering help.
We actually, it's a very funny thing that we in our survey, we actually got like exactly 50-50%. And I can show you, if you want to see more, I can show you the whole survey report, that it was 50-50. 50% people were asking for help, and 50% people were the younger people, like our Andrew and user and another user. He was able to, he was willing to help, like all of the younger people, they are willing to help because they know. And the people like me, I also want to help, because in my neighborhood here, I texted one elderly couple that, do you need any help? I am ready to help. So this has happened with me, because I empathize the problem by myself, because my dad is over there, he's suffering. So here, whatever I can do, I will do. So I think that this is a global problem, and we are working together as a mankind. So this is a problem of mankind. So people will be more likely to help.
Right.
There is
That's
no
cool. That's really great to hear that a lot of people would be willing to help.
Yeah, definitely.
Yeah. Okay, it looks like those were the questions for now.
Great, and we are actually on time for the questions. So thank you very much. We can move on to Jesse. And so if you do have any kind of supplemental materials or links or anything like that, feel free to put it in the chat. And then we will be recording. So if you would like to add any special links to prototypes or anything like that to our main doc, which is at sfuxd.com/jam, we can also add things there as we continue to follow up. And there'll be a little bit more on that later. So I think Jesse is queued up. So Jesse, when you could share your screen, hopefully successfully this time. Looks good. I will go ahead and start the timer whenever you're ready.
Okay, yeah, let's go ahead. So hi everyone, I'm Jessie. I worked with Team 13. And that was Alina, Asha, Gayatri, myself, Kshitij, Lauren, Ola, Richard, Sanya, and Sneha. And the problem that we started first with kind of thinking about what kind of problem areas we wanted to explore, but eventually we all felt that it was really critical to try to solve the problem of kind of shopping and getting essential supplies during COVID-19. And we settled on, on North America, we kind of looked at different areas, but most of what we found was in urban and suburban areas. And we kind of did our sprint over a period of 2 weeks. So this is kind of where we got to. We did a lot of ideation. We didn't quite get to the prototyping and the testing, but I'm happy to share a lot of the wireframes as we go through this. So we started first with some secondary research based on what we already know and kind of saw and heard from friends or on social media or through the news. And we felt like the problem was that it was hard to know what supplies are available to consumers and where. So we did a little bit of rapid ideation just based off of kind of what we've already seen and known. So we thought, how can we help people get all the items on their list? How might we help people organize their trips? And how might we help people know when is the best time to go to the store? We came up with some ideas of who these people might be and what might be the challenges or solutions for them. But taking it a step back, we always want to think about what is the problem that we're trying to solve and trying to understand that space. So we actually put a survey together through Google Forms, and this is some of the things that we learned. So we received over 95 responses. We found that it was kind of a split between urban and suburban areas. Maybe this is a little bit biased because of our age group, but a lot of our respondents were from the 25 to 34 and 35 to 44 age groups. And we wanted to understand how their shopping behaviors had changed. And we found that a lot of them, started visiting maybe different stores, buying different brands, shorter visits that were kind of early or later in the day. They try to plan ahead, or some people tried to do online shopping to kind of change up and avoid going in person. And what we found was that a lot of people were going because they were mostly just trying to get food, especially fresh produce. It was really interesting from the research as well to find that a lot of people were having troubles with their online shopping. And that's actually what kind of triggers them to go to the store, because they're out of supplies and they can't actually get what they need online, or the delivery is so slow. And we also kind of validated one of our initial ideas, which was that essentials were just not really available in some places. So forcing people to go to different stores to find that item and not sure if it was in stock. So based on that, we created some ideas of who might benefit from our product that we're building. So we built personas, another set of personas. Didn't quite have time to turn it into something a little bit more visual, but essentially it was the idea that they would have to sort of plan ahead. So we thought about how we might understand like their process, so their flow. So we did a really simple kind of flow just to try to map out what was kind of happening before, during, and after. And we also looked online. So we try to look online on social media. What were some existing solutions out there that were kind of solving for these pain points that we found, and also did an analysis. And something that really was interesting and that came out of our research was we thought about, well, what about using some sort of like ways but for your shopping needs. So that was something that we kind of continued to work on. So having gone through a lot of that research and understanding the space, we thought about, we thought about how can they organize their trips to the stores so that they minimize the amount of stores that they're visiting and their exposure outside. So what we did at this stage was, so at this stage, we did some pair designing. So all the members of my team, they got together in pairs and we did different wireframes. So this one is about booking a time. So book a time so that you can go to the store and get your supplies within that time. And you see some features here like the amount of traffic that is at each store. So for example, Costco might have a low amount of traffic. There might not be any rice or any eggs, and those are things that you wanted to get. So you would know maybe that this wouldn't be the option for you. Another thing would be to help you find what are some stores that are nearby. Or even we thought about like maybe you don't go to a store, but your needs are to go to a food bank to get some of those resources. And based on where you're located, we would try to suggest some options for you. We also had another idea that was really based on shopping lists. So this is already a behavior that people have, right? To write a list of what kind of products that they need. So in a similar way,
We have about a minute on the timer.
Okay, so in a similar way, you would create a list, and we would tell you how many of those items are available and at which stores. This is another example of doing shopping lists. And again, it would just suggest to you where it was available. This one is also, what I love about this one is that we thought about like a lot of these were on mobile, but if you're at home, potentially you could be using, let's say, your desktop, so you could have a slightly different experience on a different screen size. And for people who might fall out of our demographic, like I said before, they might be, because of the people that we surveyed and because of our age group, it might be a little bit skewed that way. So for someone who might be older or just might not have access to something like data, maybe we could have a texting option for them to help them find supplies. The second one that main one that we thought about was how might we provide easily accessible information about product availability in stores. So one idea that came out was kind of like using crowdsourcing to report these things. So you could take a photo, say what was available or missing, so other people would know in real time what was in those stores, so they could avoid a visit if they didn't need to go there. And then another way was just to kind of do it through a checklist, or even using geofencing. So you could push like a notification to someone after they visited a store and ask them, did you find all the items you're looking for? Was there something missing? And then other people would know. So yeah, that's pretty much our our ideas. But if we had more time, I think we could go back and actually do some user interviews, kind of continue to refine our ideas a bit more so that we're more focused in our solution, and even explore solutions outside of pure like digital solutions. We could explore more service design, and obviously like do some more testing so that we could get real feedback about the experience that we're building. Yeah, that brings me to the end, so I'm happy to take any questions.
Great, thank you very much.
And it looks like we have the first question already that came in. Christine is asking, did you research how difficult it would be to get an accurate real-time inventory from stores?
Yeah, we didn't do too much technical research, but what I will say is that we thought about different ways in which we could handle that inventory problem. So one was sort of partnering with the stores themselves and getting access to their inventory, and someone on their end would be updating it. But we felt like that would be kind of challenging to do. So that's why we talked about using something similar to like Waze, where it's a crowdsourced idea and people could share that available information in a more real-time fashion.
Great. And there's another question. How did you gather your survey participants?
So the survey participants, we sent it out to, I guess, mostly like our social networks and to kind of the groups that we were in. So for example, like myself, I sent it to some civic tech groups that I was involved in, and those are people of all ages, and like in different geographies as well. But yeah, I think like based on maybe just our kind of age groups, and maybe having sent it out, especially to some friends that we know, or just friends and family, that might have, I think, maybe skewed the results a little bit. So I think in the future, if we were to continue with this, we would try to get more responses from wider communities, yeah, and just reach out to different demographic types, I guess.
Great. I don't see any other questions for now. So I guess we can give it another minute. I don't know, Alex, how we're doing on time.
We do have another 1 minute for questions, but if there are no other questions, I think we can conclude here. So Jesse, thank you so much, and I'm glad we were able to fix the technical issue that we had. That concludes today's presentations, and overall from yesterday and today, we've seen a great number of presentations. Like mentioned earlier, the recording from last night is already online, and there will be another recording for tonight's event that will be published tonight. I want to give a quick shout out and thank you to all of the teams, team leads, presenters, attendees, if you were not part of a team, Mila for kind of helping coordinate and organize, and Anita for hosting and facilitating the questions. We will be continuing the conversation. A lot of teams from yesterday expressed interest in really working together with their teams to kind of continue the discussion and maybe even build out some of their apps. And internally as a group, we're looking to partner with different organizations, different meetups that might be able to turn these ideas that we have into reality. So working with different developer groups or other types of meetups and different types of organizations that could actually help us make some of these things actually come to life. I think that that covers everything I have here. Let's continue the conversation on Slack if you're not already part of our Slack channel. Mila, is there anything that we should add before we conclude?
Just what I mentioned yesterday, which is that we will be sending out a feedback since this is our first time doing it this remotely, and in the past we've just done it within an hour in person. So we know it was a really short amount of time, but it's really impressive, like I said yesterday, what has come out of this. But we will send a feedback form just to get your guys' opinion and how everything went in order to shape how we do this in the future as well. So, and I think that's it on my end.
Awesome. And some people are asking about where the Slack channel is. We'll add the link, if it's not already there, to the doc for the Design Jam, which is sfuxd.com/remote. And it's also in the meetup description as well. So if you can't find it in one of those two places, feel free to shoot us an email, just hello@globaluxd.com, and either Mila or myself will be happy to answer. Thank you very much, and we will see you next time.